Hello everyone, my name is Crisia Diaz and this is my presentation on the professionalism and future of MFT for Professor Fathy's Law and Ethics class. I hope you enjoy. The purpose of this assignment is to deepen the understanding of the MFT profession, the importance of law and ethics to the practice of MFT, to reflect on how they impact the field of MFT, and to gain insight from those in the field on potential challenges. I interviewed two mental health clinicians who work for Kaiser. They were very insightful and eager to share their thoughts on the profession. The first mental health clinician I interviewed has been with Kaiser for 15 years. They are the director of Regional Triage Center, and they are also a child and adolescent clinician. My second clinician I interviewed has 5 years of experience, and they are the Connected Care Intake clinician, as well as the medical assessment coordinator. I want to preface by stating that the information they share may differ from other integrative healthcare systems. Both clinicians shared similar feedback regarding the challenges they face in their profession. The biggest challenge they face is emotional exhaustion and compassion fatigue. Both of the clinicians stated that they have to be very, very aware of their own emotions when it comes to doing the job, and that also it's going to depend on how long you're doing the job. And that's very important to reassess every couple of months and check in with yourself to make sure that this is not happening. Aside from the regular clients, both clinicians answer the triage line, which deals with immediate symptoms, such as suicidal ideations. So they are hearing from people during their worst crisis, and that can take a toll on their mental health. Another challenge is the risk of countertransference with calls. Although telehealth is very convenient, sometimes they felt that when they're talking to patients during those calls, that perhaps their tone or how they said something particularly is challenging just because you can't see, that person or look at their body language. Now, as far as telehealth through video, it was a little bit easier, they stated, just because you're at least on camera and you're able to see your clients. Because of the emotional demands of the job, they couldn't stress enough the importance of self-care for MFTs, especially for those entering the field, to be aware of and be proactive. Both of our clinicians actually stated and disclosed to me that they seek their own therapist for their own mental health, not just to deal with, of course, the clients or any issues that may arise at work, but as well as to make sure that they are keeping everything that's going on in their lives in check, so that way they avoid having additional emotional burden. So, for example, if we all are going through things in our own personal lives, right? Like marriages, children, divorces, changes in life. And so with those changes, they stress the importance for us to be self-aware of what is going on and have some mental health services with our own therapist dedicated, because it does help with everything that comes with the job. Some of the self-care routines that they shared is one of them likes to get massages done, facials, chiropractic adjustments, and kind of take care of herself physical health. That way, she has that time to herself. The other one shared that even just setting time aside for a simple bath goes a long way, especially after a long day of work. Having boundaries and a work-life balance is really important as MFTs. So they both stress the fact that when it is time to stop working, they try not to answer any emails, they try not to make any kind of notes, and they also make sure that, they dedicate that time to their family. So establishing those boundaries is something that's really important to them. I did ask them in terms of advice that they would have for, new grads or new MFTs that are just coming on into the field, is that they told me that we can't fix and solve everything, right? Our job is to help our patients. And so we need to make sure that we do have those boundaries for ourselves, so that way we can be very successful in this job. When it comes to the role of law, ethics, and cultural awareness in MFT professions, the clinicians I interviewed stated that the Code of Ethics is the foundation for providing safe, effective, and professional care. Some of the key factors include upholding confidentiality, informed consent, and following legal mandates such as reporting abuse and abiding by HIPAA regulations. Ethics serves as the moral compass guiding professional conduct, while the laws establish the mandates and boundaries to work within. The law is clear and there usually isn't too much error in interpretation. However, one of the clinicians did share that there are some gray areas with ethics at times and cultural awareness. So to be mindful of that. With cultural awareness, the job is on the provider to seek and understand and be mindful of the different populations and how they can vary from one person to another. This can greatly impact how one manages certain patients and how that patient is perceived as well. There is ethical consideration to be given related to your license and governing body, but then also you need to look at how your own ethics and moral compass plays a part in decision making. And that was very important for them to express because oftentimes, right, we tend to confuse what is ethical versus what is moral. Licensing and future challenges in the field are several that they brought up. One of the licensing challenges are completing the required supervisor hours towards licensure is difficult because the hours are separated into various categories. Since the hours must be supervised, you have to coordinate with your supervisor and their caseload as well. So that way you can find ways to do one-on-one meetings, kind of go through all of the patients, all of documentation that needs to be done, as well as any support that they may need. After you complete your hours, you must spend dedicated time studying for 2 exams on top of the caseload you may have. And so the clinicians felt that it sometimes becomes really difficult to focus and kind of find that dedicated time for you to study. The other challenges with that as well is that work life balance, right? There's work, there is your family, there's also your personal stuff that's going on. So they felt that it was very challenging depending as well on the caseload that they have. Future challenges in the field are the demand for mental health services that continue to outgrow the availability of licensed therapists. Both of them were really happy and excited to know that there was a new class under the Mental Health Scholars Academy for Kaiser because They definitely need us in the field, and we need more people. At the same time, the advocacy for more employment options for MFD grows. So, a lot of the different departments within psychiatry, right, are in definite need of more mental health clinicians to kind of balance out the new members that we are getting every month, at least particularly at Kaiser. The future of MFT professions is very promising despite the challenges. Both clinicians had similar thoughts in regards to the future of us as a profession. With rising awareness of mental health, the demand for MFTs and psychotherapists will grow as families and couples seek specialized support. There continues to be an increasing shift towards proactive mental health care, with MFTs and psychotherapists working to prevent issues before they escalate. Preventative care will also help yield opportunities for psychotherapists to expand into community programs, schools, and workplaces to provide early interventions. Growing and expanding services to utilize licensed clinical social workers and licensed psychiatric technicians when some practices do not have enough MFTs, but there is an increase in advocating for MFT positions in broader organizations. The growing use of telehealth will improve accessibility to those who lack access to in person services due to either the services not being provided in their area or not being covered by insurance plans. Growth opportunities to specialize in specific types of therapies for clients that require more than the traditional intervention. Both of the clinicians mentioned that they would love to have more specialized practices. However, because the need to do sort of the traditional therapy routes doesn't allow for them to seek out those opportunities. One of the clinicians that I talked to is really interested in EMDR, but unfortunately, she hasn't been able to get all the trainings that she needs due to her caseload and the demand that she has in her current job. I enjoy doing this assignment not only to learn about the future of MFTs from clinicians that are currently doing the work, it was also nice to form connections with clinicians that, although I work with, we don't get a chance to talk on this kind of level. It was very beneficial for me to expand my network with professionals in the field. It was also really good to kind of start putting my name out there within the department. So that way, when I do graduate and I have my license, then I have more opportunities in terms of getting a job or a particular position, only because I will be familiar already with some of the people and they'll know my work ethic as well. My key takeaways from the interviews were that the MFT profession is constantly evolving and changing. The law and ethics plays a fundamental part in the job. Even though the profession can be challenging at times, the ability to make a difference in our client's life is rewarding. There is a need for more MFTs due to the growing demand for mental health services. I also really enjoyed that the focus was on preventative care by the two clinicians that I interviewed, since it's an integral part of the well being of the community. Supervision and peer collaboration are important to refine your skills and maintain accountability. My commitment to the MFT profession. Throughout this course, we have done several assignments that touch on a lot of these points, whether that's in this class or some of our other classes. But I wanted to just reiterate some of the ones that are most important to me. Obviously, because we are in a law and ethics class, adherence to the ethical standards, right? Upholding the code of ethics set by the American Association for Marriage and Family Therapy. Empathy and understanding, providing safe and non judgmental space where clients can feel heard and supported. The advocacy for mental health awareness and reducing stigma is something that I'm really passionate about. I want to make sure that I'm promoting the importance of relational and emotional health in society. One of the biggest challenges for me, myself, even just now, is self-care, right? I think us as people, we often put ourselves last and we take care of everyone else. So I want to be committed to practicing self-care and also self-awareness. I want to make sure that I am doing constant self-reflection to remain present and effective. As a therapist, I want to make sure that I prioritize my mental health as well to prevent any burnout and any um, emotional burnout. I want to also make sure that I maintain my professional integrity. I want to also make a commitment to diversity and inclusion, ensuring that therapy is culturally responsive and sensitive to race, gender, sexuality, and socioeconomic status. I think it's really important that in order to be effective therapists, that we need to make sure that we keep the cultural awareness in mind whenever we are seeking patients.